This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right, well, good morning, everybody. So this is about a little study that I thought was interesting, looking at pulse checks during CPR. So in general, pulse checks are obviously a very important part of when we're doing CPR to know whether somebody has return of circulation or not. Previous studies have shown that we can be very inaccurate or inconsistent at detecting pulses. You know, I think everybody knows that sometimes when somebody is very hypotensive, it's hard to know if they have a pulse. People are checking femoral, carotid. Do you have a pulse? I do. Maybe I don't. You know, other studies have shown that like sometimes it's a 17% agreement between people. About 50% kind of is a good estimate of how accurate we are telling whether someone has a pulse or not. This study was kind of interesting in trying to figure out whether the femoral or the carotid site was a better place to feel pulses. I think, you know, everyone knows that you can check both. The study compared, you know, whether you could feel a pulse to the idea of like the gold standard or what actually showed if the person has circulation with three things: whether they had an increase in their end-tidal CO2 and they had cardiac activity on ultrasound that looked, you know, good enough to give a pulse, and they had a normal or like perfusing rhythm on their EKG, an organized electrical rhythm on the monitor. And if they had that, then they said, yes, they have a pulse, and can you feel it? And this study found probably a very high kind of accuracy. They said that the carotid was 92% accurate, and the femoral was about 80% or 82% accurate. So both those are very high and very good. Question of whether that study is realistic or not to be that good. What is kind of, I think, to take away is that the carotid might be a little bit better, but the femoral is still potentially very good. I think we can all know that the femoral is a lot more convenient. There's not RT and, you know, doing CPR, and it's a lot easier to just stand down at the femoral pulse and feel it and then say, yeah, I still have a pulse here, I don't. And I think a couple reminders, besides the fact that you can check either place and carotid might be a little better, is when you're doing pulse checks, remember 10 seconds should be the maximum amount of time that we're stopping for pulse checks. So, you know, if you can't feel it and you're not sure, don't go like 10, 15, 20 seconds waiting for other things. Just if you can't feel it in 10 seconds, assume there's no pulse and resume the CPR. And then the other thing to kind of take away is that the things that they use in the study are probably good measures. Like if the end-tidal CO2 is going up, if they have a good-looking rhythm on the monitor, if their ultrasound looks good, then those are signs that things are going in the right direction with resuscitation. Maybe they do have a pulse. All right, thanks, guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.